So this is the impact of chronic disease on daily life. So basically in the article it highlights that research done on chronic skin diseases is emphasized mainly on the impacts and the consequences of the diseases on patients. Um, and that research shows that the majority of people with skin illnesses have reported a lower quality of life due to low levels of psychological, like social well-being. Um, Most research has been done on patients with atopic dermatitis and psoriasis because they're very common and they affect daily life and in physical and psychological ways. Um, but unlike other studies that focus on like general quality of life of this article, um, of quality of life, this article focuses on like specific dermatology aspects of skin conditions such as like itch symptoms. The article states that the constant itch that causes like visual skin lesions in patients with atopic dermatitis, which is eczema, and other types of skin diseases, and the stigmatization and the result are what adds to the impaired quality of life in patients with these diseases. What negatively impacts the psychological functioning of these patients is the perceived like helplessness, the low acceptance, and the lack of support from others. The point of this research in this article was instead of using like standard dermatology like quality of life index that measures like physical, psychological, and social aspects. It was instead to develop a reliable and valid self-report study that looks at the common, generic, and dermatology health-related aspects of chronic skin diseases. Methods. The researchers generated an item pool based on existing literature, which with adjusted items from existing questionnaires for the dermatology specific aspects like skin status, physical symptoms of itch, pain and fatigue, and perceived stigmatization. The item pool was evaluated by health professionals and people with skin diseases. All of the items were tested on people with psoriasis and atopic dermatitis with average ages from 46 to 47 years. They weighed the items against the main criteria for the measurement properties of health status questionnaires from before, and the 49 of the patients with eczema were in an effect study that was like a 5-session behavioral program in which they learned to cope with itch and reduce scratching. Results. The 49 people in the behavioral program showed an improvement in status, itch, and conscious automatic scratch response, so basically scratching themselves without even noticing that they are. Pain scores improved, and so did fatigue. There were additional benefits to daily life impact in the aspects of helplessness and acceptance. What came out of this self-report, um, what came out of this is that self-report measures can offer an easy and inexpensive way to gain insight into a patient's health status and their quality of life. Like unlike other data from like clinical and laboratory studies that really can't and they're very expensive. The study's advantages are that they give detailed and specific information about the health areas that are affected by these skin diseases and which are always susceptible to change because of like therapeutic interventions. The scores that reflected visual manifestations of the skin condition, like skin lesions, like stuff you can see, They showed that it leads to a behavioral pattern in like feeling perceived stigmatization, so feeling as if people are looking at you a certain way negatively. And this connects to my topic because I focus on impaired quality of life of patients with skin conditions and diseases, specifically atopic dermatitis, and what affects their quality of life in health related matters and psychological related matters.